I'm Dr. Rabia Malik and I'm a holistic aesthetic doctor. The top 3 things that I help people with are, number 1, helping people achieve their best possible skin by helping to address the underlying cause of what their skin issue is. Number 2, I think it's really about prevention, so preventing aging in the most holistic way possible, or really aging well. And number 3, it's about maintenance. So I think it's really all about aging well, and the best way to do this is to prevent a lot of, first of all, sun damage and skin damage, and then second of all, I think it's about stimulating your own collagen levels. And I think if you can protect the skin and stimulate your own collagen levels, then you're going to age well. So when it comes to collagen, this is something I get asked about a lot, and I think it's really important to make sure that you have the precursors for collagen. So you give your body what it needs to make its own collagen. And one of the major components is actually vitamin C, and you need to take this internally and topically. I've spent the last 3.5, nearly 4 years working on a product range called Skin W1 London, which is really focused on collagen stimulating active ingredients to help us stimulate our own collagen in the skin. So 3 products that have all the active ingredients in the right concentrations to help support skin health. So for me, the serum is really the standout product because it contains 4% niacinamide and 2% of the copper amino acid complex that we know really helps to stimulate our own collagen within 2 weeks of daily use. So my top tips, no matter what type of skin you have, whether it's combination dry or oily, is really to find the right cleanser for you and to find the right serum, because the serum really is the product that has the active ingredients that are going to make a difference to your skin. And really, I think to save yourself a lot of time and money and to protect your skin from potential irritation, this is where it can really sometimes make all the difference to seek advice from an expert. My top 3 non-negotiable skincare products are a cleanser, which is actually the foundation to every good skincare routine, sun protection, which I know you've heard it all before, but prevention really is better than cure, and the right serum, because serums really do have a high percentage of active ingredients. So I think if you've got those 3 things in your routine, you're set. So when it comes to different brands of skincare, I think it's actually totally fine to mix things up, but you just need to understand the ingredients in the products that you're using. So often it's actually more about marketing when brands say that you need to use everything from their brand. But sometimes they can also say that because it's about making sure that you don't use ingredients that may not work together well. So long as you look at the ingredients that are in the products you're using, that's really the key. And if you understand what you can use together and what you should avoid using together, then it's totally fine. So in pregnancy, there's so many hormonal fluctuations, and I think that can have a real impact on the skin, in particular making it a lot more sensitive for some people. Some people also have issues with acne and pigmentation that can come up in pregnancy as a result of the hormone changes. So I think the most important thing is to just stick with a very simple routine and be consistent. And I think you need to respond to how your skin is feeling. Reducing the number of active ingredients can sometimes be a good idea, particularly if your skin is feeling sensitive. Rosacea is actually an inflammatory skin condition. Often it is seen to be redness in the skin, or you can have accompanying lesions, spots, acne, but not always. Sometimes people just have flushing. So it can manifest in a number of different ways, but the common theme underlying rosacea is inflammation. There are a few different approaches to treating rosacea depending on what might be the underlying cause. I think the first thing is to try and identify what the triggers might be, and sometimes these can be dietary things. So whether that's certain spicy foods, whether it's alcohol, dairy, gluten, sugar can also contribute to internal inflammation. I think it's really important to think about what you're taking internally. So supplements, vitamin D, and an omega-3, and often a probiotic diet, lifestyle modification, and then also look at the topicals. So pigmentation is discoloration of the skin. It can be hyperpigmentation, where you get darker areas, or it can be hypopigmentation, where you get lighter areas. And mostly people come and see me with concerns about hyperpigmentation, so areas of darkness in the skin. And this can occur for a number of different reasons. Sometimes it can be post-inflammatory, so that means you might get a spot and it leaves a dark mark. But often it can also be the result of sun damage, which is often cumulative. So, it could take place when you were young, and you might be sort of somebody who sunbathed for many years, but you don't see the effects of that until many, many years later. And finally, hormones can also play a part. So often people will suddenly have pigmentation issues when they become pregnant, or when they go on certain contraceptive pills, or when they come to being in the menopause. So I think generally speaking, pigmentation is a lifelong or chronic issue, particularly if it's driven by hormones or if it's post-sun damage. And I think when it comes to treating or managing pigmentation, it's really important to understand that it's something that you're going to have to manage for the rest of your life if you're susceptible to getting pigmentation. And if someone tells you that they can totally cure it and make it all go away, then I would view that as a little bit of a red flag. My approach to managing pigmentation is actually a bit different to what a lot of doctors might use or might work with. So I tend to look at things from the inside out, and I think it's really about managing internal inflammation and making sure you have lots of high-dose antioxidants in the form of supplementation, but also combining that with the right topicals. So high-strength antioxidants and some other active ingredients that we know can help to manage pigmentation, and then supplementing that with some peel-based treatments, which I personally find to be very effective in treating and managing pigmentation. But again, it's a lifelong issue for most people, and I think you need to be aware that sun damage, sun, UV exposure is always going to be a trigger for pigmentation. So you really need to be protecting your skin from UV exposure for the rest of your life.